As we look back at 2024 on Beacon Hill, tonight we focus on a major victory for Massachusetts Governor Maura Healey.
We want to be the best and we want to be the healthiest place in the world, not just for some, but for all families, all women, and all people.
Healey said that when she signed a maternal health care expansion into law in August. Now, a newly released report shows why a change was needed. NBC 10's Bianca Beltran is in the newsroom digging into the data.
A new study from the Department of Public Health showed prenatal care was worse in 2022 than the year before, dipping from 78.5% to 76.7%. Now, the quality of care was even lower for Black babysitters and those using public health care. Now, that prenatal care can mean a lot to the development of an unborn child, and you can see that in the health of newborns. Now, nearly 1 of every 13 Bay State babies had a low birth rate. 1 out of every 11 was born preterm, and that's earlier than 37 weeks. Both of these conditions can cause immediate dangers for infants and are also linked to long-term health complications, including developmental disabilities. Now, there was good news in the study. Researchers saw that the teen birth rate dropped along with cases of gestational diabetes. But even then, we have to take this good news with a grain of salt. There is still a racial gap for teen births. Hispanic teens are 10 times more likely to give birth than white teens. And the rate for Black teens is 5 times higher. Now, as for gestational diabetes, the Department of Public Health warned that despite the decline, the rate is still 3 times what it was in 2000. Now, this year, Massachusetts signed a new maternal health care bill which expands coverage for things like birthing centers and midwives and doulas. Now, the new law also creates a new grant program for nonprofit and community-based health centers. In the newsroom, I'm Bianca Beltran.